Mood disorders involve dysregulated emotions. In our determination to gain stability and reduce symptoms, we can sometimes inadvertently forget that emotions are actually a completely normal part of life. Kids, teens, and adults with mood disorders, bipolar disorder, or its newly identified phenotype dubbed FOH, will continue to have emotions, even the so-called negative ones, even after achieving some measure of stability. Parents can forget this and sometimes struggle with the expression of emotions because the truth is they've spent so many years being afraid of the size of the emotions that go along with the mental illness their children struggle with. They've spent so long walking on eggshells to avoid triggering emotional outbursts in their children that they've developed a post-traumatic stress response to the children expressing any emotion. As kids and teens with mood disorders stabilize, parents often find themselves experiencing that stress response even when the emotions and their expression are expected, reasonable, and developmentally appropriate. But that post-traumatic response to these emotions is happening because parents are anticipating and fearing an exaggerated and extreme response. As a result, parents often interpret a great deal more emotion than may actually be expressed. For example, it's perfectly reasonable for a teenager to get angry if their parents take away their phone and tell them they can't take it to school. The teen might get upset, speak angrily, stomp away to their room, and slam the door. We may, out of habit, interpret this as defiance, oppositional, or disrespectful. But before reacting, take a step back and take stock of what's actually happening in the moment. Is the child expressing their dissatisfaction with the situation, but also fundamentally accepting it? Do they want to have their phone, but are still leaving it with the parent when they leave for school? If so, then they're complying, even though they don't want to. But this is normal or usual teenage behavior. They don't have to want to. It's okay for them to be angry, and this is actually progress. But perceptions of expressed emotion are important. When a parent has spent years coping with unexpected and intense emotional outbursts from their children, they may initially feel emotionally triggered themselves by any display of emotion from their child. This is really expected, and when your child has a regular old bad day, or when there's a temporary resurgence of symptoms, it's not uncommon to feel some concern or even panic. But this isn't really about the child's emotions. It's about the parent's own fear that their child's progress may have stopped, or worse, might be moving backwards. Or if it's been a very long time since those symptoms and behaviors have occurred, parents may be surprised or taken off guard and experience the emotional display as a more significant problem than it actually is. These reactions can, over time, be overcome as parents become acclimated to the new reality of a child or teen who's gained some stability. A simple technique to manage this is to allow oneself to have a response, but to pause before acting on it. We call this putting a breath between the action and the reaction. You can literally close your eyes, take a deep breath in on a count of 10, hold it for 10 seconds, and then exhale slowly for 10 seconds and open your eyes. During this time, your heart rate will slow down and you can remind yourself that whatever incident has happened is fundamentally different from the past behaviors, that it's not a full force resurgence of symptoms or a backtracking of progress, and that you and your child can both handle this and get through it. Then you can refocus your attention on what's actually happening in the moment. When this happens, the child or teen may also be confused and possibly scared at first. When they've gone a while without experiencing the emotional volatility that comes with the symptoms of a mood disorder, they become used to that new normal. But when they find themselves feeling angry or sad or frustrated or even really happy or excited about something, these normal emotions and reactions to the environment may feel unfamiliar, or worse, feel similar to the beginnings of their old out-of-control emotional experiences, and they may fear that they will lose control again when they've just started to have some. This is an area where, as trusted grown-up guides, you can help your children to understand what they're feeling by putting a name to the emotion, identifying it and its effects for them, and reflecting back the feelings they're experiencing in order for them to understand. For example, you could say to a child who's getting hyper, "You're feeling excited right now, and that's okay. It's totally expected that you're excited for your birthday party." Or you could say to a child struggling with their homework, "I can see that you're frustrated right now. You want to be outside playing, but you have to stay here and finish your homework. That would frustrate me too, and I'm so proud of you for sticking with it, even when you don't want to." In this, the parent has acknowledged the child's feelings, normalized them, made the child feel less frightened of the emotions themselves, and therefore more open to any behavioral redirection that might be necessary. And it's given them positive feedback that will increase confidence and self-esteem during this time of frustration and potential fear. Children and teens with mood disorders, bipolar, and FOH experience a lot of anxiety as part and parcel of their mood disruptions. In fact, it's so pervasive that children with these disorders are very often misdiagnosed with an anxiety disorder. Unfortunately, the anxiety won't go away by itself, even when they achieve stability. But there are medications that help with anxiety, including ones that can be taken every day to manage chronic anxiety, and ones that are only taken during times of escalation. These kind are called PRNs. This is Latin for pro re nata, which means as the thing is needed. These PRNs can be given in the moment to help calm and de-escalate debilitating anxiety. And while these medications can be very useful, a significant amount of improvement in anxiety will come from the therapeutic work they do once stable enough to identify their anxieties, and therapy will help them develop tools for coping. Once treatment has gotten a child or teen back on that level playing field we talked about earlier, the therapist's traditional toolbox of talk therapy, usually person-centered and relationship-focused, play therapy, and skill-based therapies such as cognitive behavioral therapy and dialectical behavioral therapy will start to reap rewards. Regular visits with a therapist will become an important piece of an effective treatment plan, and mental health professionals can help parents and children develop the necessary tools to manage and overcome anxiety. Sometimes there's a significant wait to get appointments with therapists trained to work with children and teens. In the meanwhile, families can use some of the many wonderful workbooks and storybooks that are available to help kids manage their feelings, such as the Worry Workbook for Kids, helping children to overcome anxiety and the fear of uncertainty. What to do when you worry too much, a kid's guide to managing anxiety. The Anxiety Workbook for Kids, take charge of fears and worries using the gift of imagination. CBT Workbook for Kids, 40 fun exercises and activities to help children overcome anxiety and face their fears at home, at school, and out in the world. These books and others explain anxiety in ways that are simple and easy for children to understand, using metaphors and pictures and clearly outlining steps to manage anxiety that are doable and help children feel a sense of empowerment over feelings that used to be overwhelming. These books also help to normalize the anxiety kids feel and to provide techniques for expressing feelings and staying calm. There are similar books for tweens and teens, including the Anxiety Workbook for Teens, Mindfulness for Teen Anxiety, the Relaxation and Stress Reduction Workbook for Teens, and CBT in 7 Weeks, which has an accompanying workbook. There are pros and cons to all of these books, and there are certainly many others out there as well that you should feel free to try. This list is just intended to get you started looking at some of the tools that are readily available with no appointment necessary as you get started tackling some of these chronic struggles. Links to all of these books can be found on the CMHRC website, and CMHRC does not receive any promotional fees for recommending these books. These recommendations come from CMHR family and professional community members who have used them and found them to be helpful. But no matter what emotions a child is facing, there is one tried and true response that will help. Let them know they're loved. Remember, all children fear losing the love and affection of their parents and seek their approval. Children with mood disorders, bipolar, or FOH are no different, except in the fact that those fears are amplified by their illnesses. They have to be reassured, overtly, directly, and with words, that they are still loved and lovable when they're in trouble, they've done something they regret, or even when they've made a simple mistake. These common occurrences can throw them into a pit of doubt and fear that escalates their symptoms. Hearing a parent say, "I love you just the way you are," is a good, straightforward way to let the child know they're loved. But there are also lots of other ways to share those feelings that are effective as well. For example, hugs can be a very useful tool with a child who likes hugs. Not all do, but for those that do, providing lots of hugs can be useful because it can become an effective de-escalation technique when the child is feeling emotional or they're stuck in an old behavior pattern. Asking, "Would you like a hug?" or "Would a hug help?" can break through the cloud created by their struggle. The physical experience of a hug can also do a few things. First, the physical contact has a calming effect that allows the heart rate to slow down, physical tension to dissipate, and for the other physiological effects of the fight, flight, freeze response to reduce and level out. Second, it shows the child in a concrete and tangible way that they are loved and that they are still lovable even with all of their feelings. This awareness, whether conscious or not, will reduce their anxiety levels. Third, it breaks through their thoughts or any cognitive cycle they may be stuck in. So after the hug, you have a better chance to talk with them about what they're feeling. The soothing that comes from this loving gesture can assist you as you try to engage them in conversation about their feelings about their feelings, and about strategies to help them accept their feelings without getting stuck in repetitive thinking, rumination, or perseveration. This small action shows a child what matters. They do. It shows them, whether they are aware of it or not, that they are protected. They have an advocate in their corner. They are cared for. and most importantly, they develop the ability to trust others and to know that they're safe. To a child with mental illness, nothing matters more than this. Once the symptoms of mental illness are addressed, the child will be able to learn coping skills, and knowing you're there as a trusted grown-up to love them through all of their efforts, to never give up on them, and to show them that their efforts matter, that will make all the difference.